I wanted to go back to your point about kind of design, and I think this presentation was excellent for giving us a nice summary and things that we want to think about in design. And I guess the question that I have is, now that we have this very nice solid evidence on capacities and acknowledging that it's different in different places, do we start designing around capacities? That is, when we're elaborating either an activity or a project, should we be looking at what capacities that project or activity is going to build, as opposed to perhaps some of the more traditional ways that we've designed things, which is we happen to have this type of money, ergo we design something that fits in that box.
So one of the things that, should we take several questions or just answer one at a time? Several? Okay. Okay, I'll come back to that.
Yeah.
I have a real simple one. The number of shocks that households experience over what length of time?
Over a year.
1 year?
Yeah.
Wow.
Yeah, shocking, isn't it?
Thanks so much for the great presentation. And I'm guessing this might be covered in some of the later discussions, but I was also interested to hear a little bit more about some of the trends and themes that have emerged in terms of sort of correlating the various capacities to the actual impact and outcome level of years.
That's the next presentation. Yeah. John.
Hi, John with Mercy Corps. I had one that's kind of a follow-up to Andre's. So assuming we should be targeting capacities versus our kind of sectoral areas, Tim, what you've laid out from this overview of kind of the 7 studies is, on one hand, basically saying like everything that everyone is doing is probably a pretty good thing, depending on exactly where you're doing it. So we'd like to hear a little bit about anything that didn't work or didn't matter in the same way, because that doesn't quite come out, and I think that could be as insightful as some of the things that did. And it might help respond to Andre's question to sort of say, okay, if we are in the DG, when the economic growth kind of hats, what within that should we be focusing on?
Right. So I'll come back to your question now. So one of the issues for me is not that you should be programming just around capacities, but you need to understand whatever interventions that you're promoting, what capacities are strengthened through those interventions. And we're starting to get enough evidence now to understand how does livestock productivity interventions actually strengthen capacities, and which capacities does it strengthen? How does pastoral natural resource management strengthen capacities? Which one is it strengthening? Which ones is it not strengthening? How does climate change adaptation type interventions, what are they doing in terms of strengthening capacities? Or how do financial services strengthen capacities? So I think you can still have a pathway, think about a pathway, and this is why theory of change is so important. Understanding how your interventions are addressing the shocks and stresses that are happening in your area, and then how the different kinds of interventions that you're thinking about actually enable certain capacities to be strengthened, which we know those capacities are determinants of whether or not resilience can be realized or not. Okay, now the other thing that's important here is that when you think about capacities, resilience capacities, people may have access to strengthened capacities, but they may not use them effectively to deal with the shock. You can have, and you'll see in the presentations that are coming up, you can have households that are matched up perfectly in terms of all of their characteristics, same capacity levels, but they do things differently. And as a result, because they cope differently or they follow different strategies, they may actually end up not being resilient. Even though they have the potential to be resilient, they may not be resilient. Okay, so that's another area of programming that we need to think clearly about is, even if we build capacities, how can we make sure people are choosing the right approach in using those capacities? You know, so I'm just like, for example, I may decide that it's better for me to send my kid to the urban area to make money, to send money back. Whereas another guy decides that I want to keep my family together, so I'm just going to take a loan out that puts me in more debt, even though we have all the same capacities. So one choice ends up creating more debt, the other choice might actually generate another income stream. So, you kind of have to trace how this works out over time. And so that's why it's so important to have multiple measures over time to actually see whether these strategies are working. Yeah.
Hi, I'm Eric with Save the Children. I'm in the health sector. And I was yesterday at the USA Systems Summit, and I wish you'd been here. It brought a lot to the discussion. But one of the discussion we had there was about how much adaptation we can have to central solutions versus contextual design in context. And what I get from your comments about context and your last statement about participation in the interventions actually was itself a predictor of better outcomes. So I wonder whether you're making the case, in fact, for the fact that participation, engagement, is not just a means to an end,
Right.
but it's part of the solution. Even if your last example, even if people are going to make better choices or suboptimal choices, the fact of being engaged in any solution, especially with others, is going to have so many ripples, learning, and etc. So there's like a diffusion of the learning and the resilience mechanism. I don't know. I'm trying to put words in your mouth, I guess.
No, I would not disagree with that, actually. And you're going to see from the presentation I'm about to make that holds true on the work we did in Prime.
Yeah, if I could just add to that too, I think it's a really good point when it gets to Andre's question about how does this apply to how we design and implement. And again, I think we're going to have some good discussions today, but this was really, really rich topic of conversation in Uganda, right? Because people do want to know, well, what do we do? What do we do for our context? What kind of activity is going to lead to some change in these capacities? I think some of the guidance that's been produced to the Real Award, including that by Mercy Corps, I think sheds a really good lens on it. It's not just what we do, it's how we do it, right? And so for some of these conversations we're involved in of how do you do programming at a systems level? What was really good in Uganda was that you had very context-specific examples between counterparts, USAID, and implementing counterparts of what does it mean to effectively sequence and layer given what we're up against. How do you make sure that you're strategically coordinating, say, nutrition interventions and livelihood interventions in health in a way that is built around achieving some increases in capacity. So it's that how we kind of do it together that I think is really important, not just what we do.
Yeah.
Hi, Jamie Montgomery, USAID. I had a question about your remarks on doing adaptive management and monitoring how capacities are being strengthened and or used. So just wondering if you had any thoughts you wanted to share on what that would look like in terms of best practice. Most projects are doing some type of routine quarterly monitoring around indicators and targets. Is that enough? Should they be doing something differently? What would that, generally, recognizing things differently?
So, I think we still are going to have a webinar on recurrent monitoring systems, right, eventually. But we can get into much more detail during that webinar, but I'll just give you a couple of ideas off the top of my head here. What we have found is that where you have that kind of information feeding into the decision-making, where you're collecting routine data and you're analyzing that data, and then it enables you to make good decisions with regards to, okay, this combination of things seems to be working, this other combination is not working so well. One of the problems that we've had is, and we were almost being purists on the impact evaluation stuff, we thought we didn't want to intervene and necessarily influence the organization we were trying to do the impact evaluation for. But we soon realized that that wasn't a good idea. We needed to actually have dialogue. So Diana and I started talking to each other when we were getting this information coming out from the recurrent monitoring. Hey, this is kind of important. You should take this into account. This seems to be working. This one doesn't seem to be working. These are kinds of strategies that seem to work better. So I think we realized that the faster we can make that information available to people, not wait till we're completely done to do the growth regression analysis, to kind of give that information sooner than later, really is helpful. And so as a result of that learning, the work that Mercy Corps is doing in several countries, the work that we've been working on in Bangladesh, we now have monitoring systems that are feeding directly into the decision-making of those implementing partners, and they're using that information to make adaptive management decisions. And so we've learned that recurrent monitoring is a good thing, but we've also learned that we need to make that information available sooner so that people can actually use it more effectively in making the right decisions. And, so it also, we're evolving, and we recognize too that one of the biggest problems I've had in all of these studies is people don't know where they're implementing. They can't tell you what geographical location a particular intervention is going on. And so if you're trying to determine whether your interventions are making a difference, you got to know where you're doing it. I'm sorry, it's true. So you can't kind of do it retrospectively. You have to keep that information. That information is just as valuable as anything you collect in a baseline or an end line, so that we can actually line up the results and we can see whether the results are being influenced by these different interventions, and which combination of interventions seems to make a bigger difference. So we're learning that is an important thing, to make sure we're mapping this stuff more carefully. We're trying to make sure, especially this is the case when you have multiple agencies implementing projects in the same area. They don't always share that information across the agencies. And so we're doing that, but we're getting better at that. So that over time, this will not be a problem, right, Janina?
Sure, Tim. Thanks, Tim. Hi, Karen from Tango. And this has been touched on already, but just to get back to some of the questions, I think what we were really seeing with the Prime and Preg is and there's this sort of drive now to better understand how to intervene at the systems level for longer term change and how to measure that. And that's really, really important. That takes a lot of time, right? And so what we're seeing, I think, is a bit of a gap. And so I just want to point out from a design perspective, it's also really important to take the time that it takes for change to occur into account, and to ensure that we're still targeting those household and community levels to support that facilitation to participate in systems level change.
Right. In fact, one of the things that I'll mention more later when we talk about the Prime intervention, those systems level changes that the project actually brought about may not actually come to fruition in terms of the impact until long after the project's over. Okay, it might be 2, 3, 4 years later when those systems level changes are actually kick in and people are actually taking advantage of. And so we're kind of restricted to a 5-year, 6-year time frame in terms of doing the baseline, doing the midline, doing the end line, and then measuring whether or not we made a difference. I am convinced that many of the systems level changes that were made in the Prime program are not really going to show up until next year or even the year after, long after the end line is done. So I think that's the important thing to recognize, is that some things that we do in terms of interventions, we're going to be able to determine quickly whether they made a difference. Other things take a little time to kick in, whether it's a policy change or a new market system that's been put in, or change in governance, change in service delivery. All of these things take time to actually come to fruition. And Mark, did you want to say something?
Oh, yeah, I just wanted to follow up on that. I'm Mark from Tango. I think in addition, the systems level changes and impacts, I think, are an important one. There's this time issue that Karen and Tim have raised. But I think it's also an area where, in terms of resilience measurement, it's an area that for future work. I think that up until this point, our analysis has been really focused mostly at the household level and looking at how households, how the household outcomes are affected by the systems. But I think there's a whole new area of measurement that we need to not start thinking more carefully about now, which is looking at systems and what different kinds of information do we need to collect, and how do we go about collecting that from not from households, what is the appropriate source of that information? How do we collect it and how do we integrate that into our resilience measurement?
Just had a quick question on, for Tim. Can you shed a little light on how receptive USAID has been to ex post evaluations, which kind of speak to this issue that you brought up around lag effects of, I think of not just our systems measures, like if it took 7 generations for people to get into the situations that they're in, it's not going to take a 5-year project cycle to make them quote unquote resilient. So just in general, what has been the receptivity to saying, actually, we should probably go back 3, 4, 5 years afterwards to test some of the sustainability of the effects or effects that maybe we just didn't capture before?
I know that Food for Peace has been doing these post-project evaluations in both Malawi, and they're about to start one in Bangladesh. I don't know where BFS has done this, but if you know, let us know, because I don't know.
It was a bit of a planted question.
PPL had a whole series of sustainability studies that I think went beyond the food and ag space.
The Malawi mission directly, commissioned one. So there are a few examples out there, but
Right.
it sounds like we may need to think about that methodology.
Especially if we're going to be doing these systems level changes.
Yep.
And the other thing that, for those of you who are much more familiar with the rhetoric than I am, self-reliance is going to be very focused on systems level changes. And so we need to make sure that we have the right metrics and the right time frame to be able to capture that. Any other questions? Yeah.
You talked about the focus on household and systems. What about communities? In the data that you had provided on the number of shocks, that's at household level. Can you?
We also collect data at the community level.
And what did you see major differences between household, number of household shocks and community?
Well, okay, so there are. Too bad you weren't at the presentation on Monday. Anyway, we have this important distinction between kind of objective and subjective measures of shocks. And so at the community level, we do collect information on the kinds of shocks people have been exposed to. We also collect that from the households.
Yeah.
And then we also use satellite imagery or market analysis to determine other kinds of more systems-wide shocks. For example, we use the flood and drought monitor system to kind of check out what has been the rainfall changes in an area over the last several years in this area. It's particularly in the time frame where we were collecting the data. So we try to use a combination of information sources. And one of the things that is really important is people's perceptions of shocks is important to capture, because sometimes when a objective measure like rainfall variability shows that a shock hit, people may be so used to dry conditions in that area that they don't really see it as a shock anymore. And if people don't recognize a shock, they may not change their strategies in a way that enables them to manage that shock more effectively. So if you continue to plant maize in an area that continues to have decreasing millimeters of rainfall, you're going to have failure of maize production every time. So there's lots of examples of that in many countries around the world. So I think part of it is when we talk about information being a key capacity, people's access to information being a key capacity for people, recognizing that climatic conditions are changing. You need to rethink what you're doing in terms of planting, or rethink what you're doing in terms of animals you're raising, or rethink about your livelihood strategy, whether it needs to be something different, so that you can actually manage that change. But communities are going to be an important part of managing that change as well, because a lot of the informal safety nets are at the community level. A lot of the service delivery tends to be at the community level. So we want to make sure we're constantly capturing that information as well. Yeah.
Antje Becker-Becken from Save the Children. I'm wondering, following on to the colleague's question, how you deal with the fact that information by itself doesn't change behavior, and that capacities also don't turn into action by themselves. And I'm wondering if the constructs of social and behavior change could be helpful, actually, for continuing discussions with regard to context, gender norms not only, but social and gender norms, and the relative weight of those and how they interact with each other could be helpful to figure out how basically knowledge and motivation and risk perception and many of the constructs that we're working with, which are often not only the psychological ones that you're starting to use, but a mixture of psychology, anthropology, sociology, and bring in the experience that we have over the last 30 years with SBC so that you can leapfrog a little bit with the measurement when it comes to household and communities.
You know, that's an interesting comment because I was talking to Zachary from the BFS on Monday, and he's turned me on to a couple of books about social architecture and how social architecture really has a huge effect on how social capital gets built into in an area. And there's been these studies in Chicago neighborhoods, for example, on how different neighborhoods in Chicago handled heat waves that were really serious, killed a lot of people, and a lot more deaths in the places that had different kinds of social architecture than others. And then there was another study that was done in another place that he pointed out. So I think we have variables that we're collecting that will give us some inkling on social infrastructure that we need to use more effectively and start to collect more information around that so that we can actually understand why that's an important factor in helping people manage shocks and stresses. So I totally agree with you. One of the biggest problems we have with this resilience field is everybody wants to add more stuff. And, you know, I totally agree. This is a very complex phenomenon, and you need to, you know, really look at it from a very wide open. And so I'm not opposed to it. I just don't put it all in one questionnaire is the thing. Yeah.
Tim, at the risk of adding more stuff, I'm curious, especially, you know, having looked at the information from DRC and other places, you mentioned kind of the growing challenge of conflict. And that's something that we're seeing in a lot of places. And maybe it'll come out a little bit later, but is there anything you can say about conflict, both, you know, people's resilience to it as well as its effect on some of these other things, and how we might be thinking about programming differently when we're trying to build resilience to conflict, if we can do such a thing, versus perhaps resilience to some of these more recurrent natural, you know, shocks, the recurrent climatic shocks, which has been kind of our traditional frame as we kind of also start thinking about a different frame as well.
You know, we are collecting more information on conflict in these studies and trying to understand what effect the conflict has on like, for example, in the L4R study we're doing in Ethiopia, conflict has had a huge effect on functioning financial services. It's had a huge effect on people's ability to migrate. It's had a huge effect on people's access to health services, because if they're in the wrong ethnic group, they can't use those health services. So yes, we are trying to understand that dynamic, but we're just starting to, I think.
I was wondering if maybe from the DRC example, if there's anything you could pull. I was particularly interested that you had a bullet point in there about government responsiveness in Eastern DRC, which is not usually the place that one thinks of that. Because I think one of the things we're all struggling with is you see a lot of positive things that come from better governance, more responsive governance, but we're being pushed ever more into places where that isn't the defining feature of that location.
Right.
And what are the workarounds, or what are other ways that we can get at some of those things in those contexts?
So I think Mercy Corps has been active in looking at resilience in conflict settings. You guys want to say something?
Yeah, I mean, a few things stand out that actually aren't too far off from what Tim's already presented. I mean, in lieu of formal structures, you were looking at, you know, South Sudan in the protection of civilian camps and other IDP situations, and, you know, it's all about social connections there, and they're forming in different ways than they did pre-crisis in terms of livelihood groups versus kinship. You know, so there's some nuance in there, but that one is certainly a pillar. You know, it's also an opportunity not just for sort of resource sharing versions of coping, but potential social cohesion that actually get at some of the causes of conflict. In the case of South Sudan, at least within kind of sub-clans, not necessarily, across ethnicities. But in Northeast Nigeria, I think there's some entry points there to be able to use assistance in ways that do bridge some of those divides, that go beyond just do no harm. A little bit TBD on sort of if what we and others are trying, is effective. But I think those are a couple entry points for sure. And I'll just take the chance to ask my one last question. Tim, looking at sort of some of the slides that start to synthesize data across, and you had some good tables on numbers of shocks and which capacities sort of are most commonly mentioned or found to be significant in which context. Like, are we at a point or close to a point where we could almost lay out some refutable hypotheses that would sort of be under these sets of conditions, and so take some contextual factors, shock and, I don't know, agroclimatic, whatever, we have enough evidence to say that we strongly believe that these factors will be important. So they're sort of our, again, starting points for capacities to work on, and these other ones are going to be less important given those characteristics.
I think we want to do that kind of meta-analysis now that we've started to accumulate enough of these cases that we can start looking at these contextual differences and be able to say, okay, which capacities, which shocks and which capacities are more likely in these kind of contexts that you need to be focused on.
Yeah.
I think we're almost there, not quite, but we're almost there.
Well, I ask because I think it's a good push. So for us internally, we go in and do some pretty elaborate assessment work to just try to figure out the landscape of risk and responses and all that. And it almost seems like we're starting from scratch each time, versus if we had some of these hypotheses that, again, are sort of testable. We can go in with that in mind, and as opposed to being completely sort of exploratory in our analysis, it's actually a little bit more confirming what we might find elsewhere or adding to that. I feel like that's a good push for the
I would
field.
support that, yeah. Yeah, Tom.
Yeah, I just want to add one thing. I think going back to, say, Andre's question, and when we're recognizing that the state of practice for quantitative measurements of resilience analysis are evolving, right? But there are some areas that we want to move into in terms of systems analysis, social capital, you mentioned, conflict, absolutely. One really, I think, striking thing that came out of the event in Uganda was a presentation from South Sudan in that context that really focused on how do they understand some of these dynamics. They're certainly engaged enough to know what they think resilience looks like in that context or how they can get there. So when it comes to, say, social structures and conflict, I think as we're trying to kind of push this science forward, we definitely need to keep an open eye to those who are kind of thinking through some of these really difficult challenges themselves. And how do they see change? How do they see movement? How are they kind of organizing themselves around these problems? It really gives good insight for us as analysts.
No, that's interesting. So one of the things that, back to this issue around conflict, I think I mentioned this to you yesterday. I was up doing an evaluation of UNHCR's program in the Maban area of South Sudan, which is a pretty tough region. And the UNHCR's camp was attacked last year in July by the local communities because UNHCR was providing better healthcare service to the camps than the government was providing healthcare service to the towns. And so people felt like, we're not getting the kind of services, and here are all these people that were displaced from Sudan that are in here getting much better services than we are. And so they went and they burned down the compound. Okay? So that's an example of where service provision, the lack of service provision, can actually lead to additional conflict. So you have to be aware of the fact that the lack of interventions in certain areas can actually lead to further conflict. One of the other things that was striking for us in the prime example, I'm kind of getting ahead of myself here, but we saw great improvements in the Jijiga area, which is a Somali region in Ethiopia, with regards to food security, resilience. But we saw a huge decline in people wasted. The wasting figures went way up. And we were trying to figure out, well, what happened? Why would wasting go way up in there? And it turned out that people's access to health facilities went down dramatically from baseline to end line. They dropped by 60%. The access to clean water dropped by 40%. So unsanitary conditions, not having good access to healthcare made a huge difference. And so even though you're improving food access, you're canceling all your efforts out because people are losing that positive gain by having bad water and no health. So this calls into play for me, when you do take a systems perspective and you are trying to understand the role of nutrition, the role of healthcare in these studies that we're doing, we tend to be too ag focused or too livelihood focused or too livestock focused. And we don't really understand that these other factors are going to be really critical for resilience going forward.
Joan Jennings, I'm a nutrition advisor, so I'll mention something about nutrition. Going back to this routine monitoring, having timely information that can permit you to make good decisions, and wanting impact. A lot of our impact indicators, particularly in nutrition, are very black and white. You're malnourished or you're not. And we should really be getting in there and analyzing that information better. For example, I worked with a project in Mozambique. 5 years, at the end, there was no change in malnutrition. They gave us the time, which wasn't much, and a little bit of money to further analyze that, and there had been a complete shift in the severity in the bell curve. So we know that there's thresholds that have to be reached to get over poverty, to get over malnutrition, and they were moving towards these thresholds. And I think we can maybe see movement earlier, which, that crossing the threshold might take longer.
Yeah.
So I just think there's a lot of info we have that we ought to be analyzing more.
Right.
And further.
Right. You had a question?
Yes, I think it's more of also Muna, former USAID, but I'm here on my own. I believe that considering the limitations of most implementers in areas where there are different shocks, I think the importance of layering and sequencing and also the integration of partners is very important, because we know that there are lots of limitations, but at the same time we have different shocks from different angles, and that's where we need to work together into seeing the gaps and interventions at the same time, because systems is way big for, and when that hits, it actually destroys most of the whatever has been done at the lower end. And
Right. Okay.